Dr. Albu, you have
Mr. Chairman, ladies and gentlemen, thank you very much for inviting me in this prestigious meeting. I have no conflict of interest and no sponsorship received. I'm coming from the city of Cluj, the heart of Transylvania. This is a typical Central European city, but a better reference should be the country of Dracula. And perhaps this is the reason why I was assigned to talk about preventing bleeding and maxillary sinuses and infection within the sinuses. My talk will be about not having failures in endoscopic surgery, not going from failure to failure, how Sir Winston Churchill devised us in this piece of wisdom. And the whole talk will be based on the European paper position on rhinosinusitis and nasal polyps, and this is of utmost importance for me because from the country where I'm living, where I'm coming from, following these guidelines means being connected to the scientific world. And thanks to the wisdom and foresight within this booklet, we in this hidden corner of the world are sure that we can deliver the best health care for our patients. And this is the practice of medicine which is not evidence-based. That is having a lot of experts but going in the dead end or being into the morning in the traffic jam without a guidance. And stated another way, it's the transition from a single expert and no matter how well-designed study to a well-guided and powerful army. This is the evidence-based approach in our vision. And coming back to our subject for this meeting, the preoperative medication has the goal of optimizing surgical field and outcomes because it's about preventing excessive bleeding, because excessive bleeding means on one side having difficult surgery and on the other side opening the avenue to potential and fatal complications like those depicted in this slide. And excessive bleeding implies often an excessive operating time and incomplete surgery and recurrences because it is lefting behind needs of infection and unclear disease, and this opens the way to recurrence of disease. Counting bleeding. We have different tools of measuring bleeding in the operating theater. One of these methods is the amount of blood loss. This is counted, or if we have rinsing solution, we can subtract the rinsing solution from the fluid collected, and we have the amount of blood within the operating theater. And another method is the surgical field quality, because this is a dynamic state in the operating theater, and the surgical field quality changes within minutes. And this is the widely used scale of counting the surgical field quality in 5 grades. P.J. Morwell devised another scale with 10 subpoints, but this 5-grade scale is often used in the theater and also in the reporting results in the literature, and also counting the operating time. And these are the 3 variables that counts during our procedure. Using pre-operative, peri-operative corticosteroids is very important because of their potent anti-inflammatory effect, and also they have an powerful effect on the vascular tone, and thus they decrease bleeding. And this is the reason why they are often used as a perioperative medication in the aim of decreasing bleeding and reducing the operative time. And these are the studies that were mentioned in the EPOS paper. There are 4 studies. 3 of them use general corticosteroids and also topical, and only 1 study uses topical corticosteroids. You can see from this graph that various dosages and various times are employed in the literature, thus no valid conclusion can be drawn. Using oral corticosteroids although they are very effective because of their anti-inflammatory and immunosuppressive effects, they do have many undesirable side effects like weight gain, hypertension, increased risks of infection. They affect the natural mineral corticosteroids metabolism, and they also provoke mood disturbances. And this is the reason why we do have to keep a delicate balance because between the desirable effects and the undesirable side effects of the oral corticosteroids. And all those studies are put into a meta-analysis, and the conclusion can be seen on that graph. You can see that using peri-operative corticosteroids versus placebo on blood loss, there are 3 studies that could be put into this meta-analysis, and we can see clearly that a reduction of blood loss of 54 milliliters is obtained in these studies. And using peri-operative corticosteroids, we can have a better surgical field quality, and the duration of surgery is reduced in a value of 15 minutes. This is the analysis, the meta-analysis relationship. Thus, using peri-operative corticosteroids, we can definitely have a reduced blood loss in our surgical. We have really an improved surgical field quality, and as a conclusion, we will reduce significantly the operation time, and this is very important for the economics which drive our life. And this conclusion is based on 1 study using topical corticosteroids and 3 studies using general and topical corticosteroids. And the recommendation of the EPOS committee is to use nasal corticosteroids before surgery whenever we can do that. Now we come on to the use of antibiotics. The use of antibiotics seems to be very logical because we do want to reduce the infection rate and thus to increase our success rate in surgery. And these are the studies mentioned in the EPOS guideline. You can see that there have been double-blinded placebo-controlled studies using antibiotics versus placebo, and the outcome was either an objective one, either a subjective one using the SNOT sequences. And all those studies noted no difference between placebo and antibiotics, with the exception of our study, because we used a more delicate and more balanced objective measure. This is the peri-operative sinus endoscopy score, because this takes into advantage also it takes into the account also the score within the middle meatus and the secondary sinuses, and we were able to see a small reduction, significant reduction in the obstruction and in the drainage score, and also in the peri-operative sinus score, but this, although it is important statistically, clinically, is insignificant. Thus, antibiotics are not routinely recommended in the peri-operative use, with 1 single exception, because in odontogenic sinusitis, the paradigm is quite different, because bacteria, like a Trojan horse, disrupts the Schneiderian membrane and acts and infects the maxillary sinus. Thus, antibiotics are mandatory in this surgery. And I would like to thank my team for providing me support for this presentation and being behind me in the everyday work. And in Norway, this is a desire. And as a desire, I will quote Martin Luther King, because I definitely will remember the silence of our friends being here in this meeting and not the words of our enemies. And I would like to thank you very all for being so kind to listen to my presentation. Thank you very much.
Thank you very much. If we have any questions.